Hi there, this is Stephanie with a suggestion for you. I often get asked by parents how to help find the right therapist for their teen, especially if their teen is reluctant to attend therapy. And so one of the things that I suggest is that when you're looking for a therapist, the wonderful thing about the internet is that we're no longer confined to our geographical area. You have the whole world now available to you, and that just opens up so many more opportunities. So the first thing that you should do when contacting a therapist is ask them if they specialize in working with teens and young adults. And this is important because if they treat anyone and everyone, they may very well be a great therapist, but they might not have as much of an understanding of how the teen mind works and where they are developmentally. So it's important to find someone who specializes and works with teens almost exclusively in their practice. So that's why I chose to work exclusively with teens and young adults, is so that I could become very aware of the issues that they're facing, the language that they use to describe their issues, and some of the solutions that they've come up with already to work on their problems. Another thing that you want to ask about a potential therapist is, do they only have one way of treating their clients? Is there a one-size-fits-all or a cookie-cutter approach to their practice? Are they hearing the child that they're working with and working on their level? That's really important, because if your child is already reluctant to attend therapy and they sit with someone who doesn't validate their experience and doesn't allow them to feel heard, they're going to be really, really reluctant to share and open up with that therapist. And if it just feels like another adult who's telling them what to do and how to do it, that's not going to feel very healing for them. And another consideration when trying to find the right therapist or counselor is, how long will it take? A lot of therapies can take a really long time, and while those therapies are helpful and beneficial for some people and in some situations, it's a hard sell for teens. Teens want to know that this isn't going to take years, that they're not going to feel like this for a really long time. That's too overwhelming. That can lead to feelings of hopelessness. So we want to work quickly to heal their pain, to ease their pain, and then we can begin other kinds of therapies or other techniques or skills. Until we get to that place, though, it's really hard to get them to buy in. So just a few things to consider. If you're wondering about a therapist and they're not willing to sit down with you and talk to you about their practice and how they work, maybe move on. It's the reason why I do strategy calls with people. I don't want to tell people that I can help their kids and then find out that I don't have the right skill set or that it's not a good fit. I want to know that confidently I can help them in their situation before I agree to work with them. And the families should feel confident in my skills as well. And so that's why I have strategy calls, so that we can go over what I do, how I do it, and how I can help your child. And then you decide if that's the route you want to go. It's your choice. Thanks. Have a great day.